Hi, I am Dr. Aparna from MyENT. Today we are discussing on snoring. So snoring is a loud rhythmic sound produced during sleeping. So when the airway is getting blocked or it is narrower, the air when passes through the narrowed airway, it will produce an abnormal sound which is called snoring. The block can be in the nose, throat or anywhere in the airway. So normally everyone snores, right? So if it is not disturbing the person or it is not affecting his routine life, it's okay. It is not a big issue. But when it is affecting the patient's or the person's routine life, the disturbed sleep, daytime sleepiness or reduced efficiency in the work, that is an issue. Sometimes this type of abnormal snoring or loud noise during sleep can be a sign or symptom of an underlying medical condition. For example, OSA or obstructive sleep apnea. This is a condition where the patient is having a period of cessation of breath during sleeping. So while sleeping, the patient is not getting oxygen for a short period of time. So that is a serious condition, right? So why this snoring happens? So snoring is happening because there is a block. This block can be because an obstruction in the airway, upper airway especially, or can be because of the muscles which is helping or supporting the respiration can be getting relaxed, or it can be because of the edema of the airway. These are three most common causes. So why there is an upper airway obstruction? It can be in the nose, it can be in the throat or in the voice box, anywhere else. So in the nose, the most common cause is a deviated nasal septum. The midline bone in the nose can get deviated to one side. So that side get blocked. Another cause in the nose, very common cause in the nose is adenoids, which is a tissue growing behind the nose. The reason in throat, very common reason in the throat is a tonsil, a tissue growing in the throat. Sometimes the patient position while lying down, that also can obstruct the airway. When we are lying on our back, the tongue and the palate region gets backwards and that will obstruct the airway. Then also the patient will not be able to breathe like regularly. And one more important, which is commonly seen today or which is very important to discuss in the current scenario, is fat or overweight, which is causing fat accumulation in the neck region. So as of current scenario, the people are getting abnormally overweight or obese. In this scenario, there is a lot of accumulation of fat in the abdominal region and neck region, which is narrowing the airway. So the patient is not able to breathe in properly through the cavity because of the fat accumulation in the airway, which is getting narrowed. And another cause of the narrowing of the airway is relaxation of the muscles. That can be because of the aging, because of alcohol consumption, because of sedative drugs. These all can relax the muscles and which can cause the narrowing of the airway. And as I mentioned, edema can be because of smoking also. So in the current generation or in the population, there is lot of addictions, habituations like alcoholism, smoking and abnormal eating habits, which is causing fat accumulation in the neck region and causing breathing abnormalities. So what happens when we snore, or why we are discussing about snoring? Because this snoring can affect the person's routine life. Sleep is very important, right? So when we are not getting enough sleep, our daily routines are also getting disturbed. When we are not getting enough sleep, daytime we will be sleeping more, our work efficiency will be less, energy will be less, we can't concentrate more on the work. All these problems are there. And many times the patients are coming here with mental trauma or mental stress because they are not getting good sleep and they are not good at their work. So all these are very important thing to discuss regarding snoring. And another thing, not only the patient, their bystander or attender, their partners are also suffering because of the snoring issues. Many a times the attenders are bringing the patient for consultation because of the snoring issue. Another important thing is majority of the patient with the snoring might be having some hypertension, cardiovascular abnormalities, depression and irritability, mood swings also. So concerning all these things, snoring is very important medical condition, or it should be treated with a prompt care. So coming to the solution of snoring, so first important thing, get counseled or consulted from a good ENT doctor and get the proper guidance from them. Another thing, as I mentioned, overweight or obesity is a most common cause of the snoring. So we have to try maximum to reduce to a healthy weight. It should not be like underweight also. So we have to maintain a BMI for each person. So BMI is body mass index. It is calculated according to the height and weight of the person. So that should be optimum for the individual. Another thing, if the patient is having any addictions like alcoholism, smoking or any habituation, we have to stop that, and we have to give a proper mental health guidance, and we have to take care. At the same time, we have to take care of the underlying medical condition. If they are having a thyroid problem, if they are having a diabetes problem, hypertensive issue, that also we have to take care. And ultimately, if the patient is suffering a lot from snoring, there is no magical medicine to give cure for the snoring. The proper or definitive treatment for snoring is a surgery, and the surgery has to be done under skilled and facilitated hospitals only. So in our Ma ENT hospital, we have done a countless surgery called COP, coblation assisted uvulopalatoplasty for snoring, and we have helped a lot of patients. So if you are having any concerns regarding snoring or surgery, you can visit us at any time, Jubilee Hills Ma ENT. Thank you.